Hi, Dr. Anita here and welcome back. In the last few videos, we've been looking at how to move out of survival mode and into a place of functioning. But one of those areas that we need to look at is routine and what causes us not to have the right type of routine at this current moment. And number one would definitely be the area of our sleep. And I don't know about you, but sleep is really tricky where we actually are finding ourselves staying awake later into the night and possibly waking up at all sorts of times of the day. And why are we doing this? Well, number one is the area of the survival mode coming from the back part of our brain, which is firing off the fear response and causing us to feel really tense and awake in our minds and in our bodies, because it's kind of saying to us it's not time to go to sleep because there's danger. And so it's hard for us to unwind. Secondly is the area of our disrupted daily routine where we're less active and less moving, so therefore not as tired at night time as we may usually be. And then thirdly is the area of loads of screens where the blue light is coming off of the devices and causing us to feel much more awake. And especially at night time, this is a problem because it's saying to our brains it's time to stay awake instead of going off to sleep. So what is the problem with not getting enough sleep? Well, we absolutely know that we need the sleep to boost our immunity, to help us with our brain function so we can focus and do the things we need to do. And number three, that we actually need it for our mental health and well-being in general. So what do we do to actually counteract some of these things that are happening to us in our day in and day out with our sleep? Well, firstly, it starts with making sure you keep to as regular as possible a bedtime and a wake time. And even if you don't get enough sleep, not trying to correct it by waking later in the day, but really just trying to stick to the same times because your body will readjust. And then there's what we do during the day. And the truth is that in the daytime we're indoors, and so it's very difficult because we may get that sense of being in darkness, but we absolutely need to get some sunlight so that our bodies and our minds recognize the difference between day and night. And the other tricky thing that might be happening is napping, because if we've got not much to do, then we may be tempted to just sleep during the day, which definitely disrupts our regular sleep pattern. Then there's the area of what we're eating or taking in, and definitely caffeine is something that keeps us awake. So after 3 p.m, best to try and avoid it, because this is another thing that can be rattling around in our bodies and keeping us awake at night. But also be careful not to go to bed hungry, because in the middle of the night, if you are hungry, your body will wake you up and say it's time to get something to eat. If you're drinking alcohol before you go to bed, it may well help you get off to sleep, but as the alcohol is coming out of your system, it can suddenly wake you up and also disrupt your sleep. The final thing is to set aside your bed just for sleep, because if you're doing everything in your bed, then your mind and your body is confused about when it's time to wind down. So trying to set aside your bed only for the time you go to sleep. The last thing we're going to look at, and we'll look at this in part 2 of this particular video of sleep, is around wind down time, and we'll look at this very soon. So I look forward to seeing you in the next video. In the meantime, stay well and see you soon.